Hello, welcome to the Thrive class series brought to you by the Department of Clinical Nutrition at Stanford Healthcare. This series of 6 classes are designed to help you understand your nutrition needs throughout treatment. Today's class is a general overview of nutrition before and after surgery. My name is Kate Mathias, and I'm one of the oncology dietitians at Stanford Healthcare. Many patients in the Cancer Center are referred for surgery to remove tumor tissue. This is also called tumor resection. Nutrition research shows that good nutrition before and after surgery improves recovery. The class will discuss how to optimize recovery and wound healing after surgery. Goals of the class are the following. Understand the importance of nutrition before and after surgery for best possible recovery. Know nutrition strategies to use to improve recovery time after surgery. And identify specific foods to include at meals and snacks before and after surgery. Surgery can affect how you eat and possibly how you absorb and use nutrients from foods. Gastrointestinal surgeries or surgery of the stomach and intestines can directly affect the ability to consume, digest, or absorb nutrients. These surgeries have the greatest impact on your nutrition status. When we talk about nutrition status, we mean your nutrition needs, past medical history, what you're eating, and the barriers that could impact how you eat or ingest nutrients. Poor nutrition status before surgery can make healing slower because it increases the risk of malnutrition. Surgery increases your nutrition needs because your body tissues are broken down. There are potential losses of nutrients, possible changes to bowel function, and inflammation from the stress of surgery. If not addressed, surgery can cause a significant decrease in nutrition status. Nutrition needs vary depending on the type of surgery. The more invasive the procedure, the more likely malnutrition can occur. Eating the best you can before, during, and after surgery can help minimize symptoms, reduce risk of infection, and complications after surgery. Before surgery nutrition is like preparing for a big event. If you're going to run a marathon, you train to prepare your body. Surgery is similar. You want to prepare your body so that it has the best nutrition it can to have the best outcomes possible. It is important to learn about ways you can increase and improve your nutrition before surgery. This can help prevent malnutrition on your body, so that's not having the energy and nutrient, making sure it has the energy and nutrient needs it needs, increase the amount of vitamins and minerals your body can store, improve your protein intake to help keep your muscles strong. Protein helps keep your muscles from breaking down and make sure your body has enough energy for fuel for healing. And it also can help enhance immune response. Lastly, learning about good nutrition strategies can help reduce infections and other complications. To prepare for surgery, if overweight, first maintain a healthy weight before your surgery. This can reduce risk of developing complications. If you're underweight or have lost weight, please request your doctor order a referral to a registered dietitian. Focus on a variety of foods and eat a balanced diet to ensure adequate nutrition. Have a protein with each meal and snack. Have a fruit or vegetable with each of your meals and snacks as well. Focus on healthy fats to help provide calories and help to better absorb vitamins. Reduce alcohol 3 to 8 weeks before surgery. This helps with recovery. And do not drink alcohol after surgery to help with your body recover as well. Avoid vitamins, minerals, herbal supplements before surgery, and follow your doctor's advice on medications. If tracking your intake is helpful, try writing down your intake in a notebook or using an app on your phone. 2 apps that are recommended are MyFitnessPal or Lose It. Eat plenty of protein by choosing 1 to 3 servings per meal. Protein gives the body the ability to build tissues and heal wounds. The average person requires about 20 to 30 grams of protein per meal. However, each person has their own protein needs, so it's best to ask your doctor for a referral to see a dietitian to discuss your personal nutrition needs. Some examples are listed on the slide. Protein includes poultry, beef, fish, eggs, dairy, beans, nuts, seeds, and tofu. Make it your goal each day to eat 4 to 5 servings of vegetables and 2 to 3 servings of fruits. A serving is about half a cup of cooked or chopped fruits or vegetables. Fruits and vegetables provide fiber and vitamins and minerals that can help with healing. Some examples of fruits and vegetables are listed here. Reduce your intake of saturated and trans fats, typically found in animal products and processed foods. Try to add more healthy fats into your diet from plants and fatty fish like seeds, soybeans, nuts, avocados, and salmon. In general, total fat intake should be 20 to 35% of daily total calories. However, each person has their own dietary fat needs, so ask your doctor for a referral to see a dietitian to discuss your personal nutrition needs. Some examples can include 5 ounces per week of nuts or seeds, 6 to 8 ounces per week of seafood, preferably an oily fish like salmon, mackerel, cobia, striped bass, herring, or sardines, or 3 tablespoons of oil per day, or 9 teaspoons, preferably from plant oils like canola, corn, olive, soybean, or safflower. After surgery, nutrition is a vital part of the healing and recovery process. When we provide our body with adequate nutrition from carbohydrates, protein, fats, fluids, and micronutrients, it can help our body heal quicker from surgery. After surgery, the body needs extra calories and protein for wound healing and recovery. This is when people have pain and feel tired, which can make it more challenging to consume your adequate nutrition needs. After surgery, you also may be unable to eat a normal diet because of surgery-related side effects like nausea, vomiting, diarrhea, constipation, decreased appetite. And another important aspect of after-surgery nutrition is that surgeries on any part of the digestive tract can change the body's ability to use certain nutrients. During recovery, the goal is to maintain your weight and ensure you're receiving adequate protein and calories by mouth or through an alternative source if necessary. For example, a feeding tube or IV nutrition. Research shows that if you do not receive enough protein, this causes the loss of lean muscle mass. This happens because your body will begin breaking down muscle to provide fuel for your body to heal. The loss of lean muscle mass can impair your functional recovery, which could impact your physical quality of life. If you can eat by mouth after surgery, nutrition is a priority for healing. In addition to calories from protein, carbohydrates, and fats, your body also has increased need for vitamin A, C, and zinc to help with wound healing. When looking for vitamin A-rich foods, look for red, orange, or yellow fruits or vegetables because they contain carotenoids, a source your body uses to make vitamin A. Dark leafy greens, sweet potatoes, carrots, mangoes, dried apricots are some examples. Other sources of vitamin A come from eggs, dairy products, and organ meats. When eating vitamin A-rich foods, consider eating them with a healthy fat like nuts or avocados to help with absorption. The source of zinc that are best absorbed are shellfish and lean meats. Other sources of zinc are whole grains, peas, lentils, and chickpeas. Vitamin C is found in citrus foods like oranges, lemons, limes, and kiwi. In other foods you can find vitamin C are bell peppers, potatoes, and berries. Discuss with your surgery doctor if a vitamin mineral supplement is appropriate. After surgery, some patients may have side effects due to the type of surgery they had or medicines that they take. Some common side effects can be decreased appetite, nausea, vomiting, diarrhea, and constipation. The next 2 slides will cover some tips to help with these. What if you have a reduced appetite? Try eating 5 to 6 smaller meals instead of 3 larger meals per day. So a few examples could be half a sandwich, cheese and crackers and olives, fruit and a handful of nuts, or fruit with yogurt. When you eat a meal, eat your higher calorie or protein food first in case you get too full to finish your meal. For example, eat your eggs, poultry, meat, tofu, or a higher carbohydrate food like potatoes or pasta before eating your fruits and vegetables. Try an oral nutrition supplement shake that you could sip between your meals. If you're experiencing nausea, vomiting, or both, be sure to let your doctor know. Follow their recommendations for what to do. They can also look at giving you an anti-nausea medicine. Eating smaller, more frequent meals can be helpful if you're nauseous, and choosing cooler foods without an aroma. For example, sandwiches or smoothies may be better tolerated than a hot meal if you are vomiting or if you have nausea. If you are vomiting, wait to eat until you are having no more vomiting, and then sip on fluids like clear broth, juice, water, or Pedialyte, and then begin solids once feeling better. Some patients experience diarrhea after surgery. This can depend on many factors, such as the type of surgery you have. Try eating smaller, more frequent meals and avoid spicy or greasy foods that can make looser stools worse. Be sure to also stay hydrated by adding fluids like water, broth, diluted juice, or Pedialyte to your diet. Depending on the type of surgery and the diet your doctor has prescribed, if you're allowed to eat fiber foods, consider adding soluble fiber foods like oatmeal, applesauce, peeled potatoes, and bananas into your diet. Soluble fibers help absorb fluid and can help to decrease diarrhea. If you're experiencing constipation after surgery, this may be because of the medicines that you're taking to help with pain management. Make sure you're drinking adequate fluids, about 8 glasses per day for most patients. Warm beverages and prune juice can be helpful to help stimulate a bowel movement. If your doctor prescribed a diet that allows fiber, add fruits, vegetables, and whole grain foods to your diet. These foods help promote bowel regularity. Lastly, if you are approved for light activity by your doctor, consider a short walk to help stimulate a bowel movement. And briefly, a comment on exercise. Research shows the positive effects of adequate nutrition and physical movement before surgery and the benefits after surgery. Before surgery, if safe to do so, consider adding movement you enjoy to your daily life. After surgery, once physical activity is approved by your care team, consider moving your body to help maintain your muscle mass. If you've had a decrease in appetite, movement can help increase your appetite. Stanford Healthcare offers free cancer wellness classes through the Office of Patient Experience. You can check it out at https://stanfordhealthcare.org/for-patients-visitors/cancer-program.html. Exercise and nutrition go together. Try to move your body. Please let your care team know if you have any questions about nutrition, as they can direct you to a dietitian if you need help finding resources in your community for food or access to food.